Welcome to this hyper-realistic cinematic explainer. Today, we're going to completely decode the beautiful, complex mechanics of facial muscular anatomy. If you've ever wondered exactly how a smile actually works under the surface, or, how cosmetic injectables literally alter our expressions to turn back the clock, well, you are in the exact right place. We're going to strip back the layers and really look at the engineering of human emotion. Let's dive in. Let's just quickly set our flight path for this 3D journey. We'll be covering 1. Forehead and frown lines. 2. Eyes and upper cheeks. 3. The mouth and lips. 4. Jawline, chin, and chewing. And finally, number 5, the nose and neck. Kicking things off with Section 1, Forehead and Frown Lines, the upper mechanics. We're starting right at the top of the face to look at the muscles that drive our biggest upper expressions. So starting right at the top of the skull, we have the frontalis. You'll sometimes hear it called the occipitofrontalis simply because it connects all the way back to the occipital bone. Now notice how this massive muscle naturally functions to elevate your eyebrows while also pulling the forehead down. This push and pull is exactly what causes those horizontal forehead lines. When medical professionals use botulinum toxin up here, the whole goal is to smooth out those lines and, in some cases, strategically give the eyebrows a nice little lift. Okay, let's look at a really crucial contrast. Dropping just below the forehead, we meet the corrugator supercilii. This guy runs from the bone just above your nose right into the dermis of your skin. Look at its natural action. It literally pulls the skin inwards. That right there is your primary frowning muscle. It's the absolute culprit behind those angry elevenses lines between your brows. But check out the treated action. By relaxing this specific muscle so it doesn't move quite as violently, we effectively erase that angry look altogether. You just instantly look more relaxed, happier, and totally smooth. Moving right along to Section 2, Eyes and Upward Cheeks, the center of expression. Let's pan down and slightly outward to the incredibly complex orbital region. Surrounding the eye itself is the orbicularis oculi. This is the most superficial muscle in the area, meaning it sits right on top of everything else. Think about what happens when you squeeze your eyes shut really tight. That's this muscle doing the heavy lifting. It narrows the eyes, pulls the brows down, and elevates the cheeks. And in doing so, it creates those wrinkles right around the edges of the eyes that we all know as crow's feet, or lateral canthal lines. Now, what's truly fascinating here is this structural trade-off. When you relax this muscle with a toxin to get rid of those crow's feet, you reverse its natural downward pull, which means you might actually get a beautiful, subtle eyebrow lift out of it. But since this muscle also elevates the cheek, treating it might subtly reduce how high your cheek sits when you flash a big smile. It's a really interesting structural compromise that proves just how interconnected all our facial mechanics are. Section 3, the mouth and lips, elevators and depressors. Let's head down to the midface and explore the crazy, intricate network that literally pulls our lips in every possible direction. Okay, just medial to the cheek, so closer to the center, is an absolute mouthful of a muscle name. The levator labii superioris aulacae nasi. Believe it or not, it actually holds the title for the longest named muscle in the human body. It runs right alongside the nose, elevates the lip, and creates that classic snarl expression. Aesthetically speaking, if someone has what we call a gummy smile, injecting just lateral to the nostril brilliantly stops this muscle's elevation. It essentially drops the lip just enough to keep the gums hidden when they smile. Dead center of the lower face, we have the orbicularis oris. Now, to the untrained eye, it looks like a perfectly round sphincter muscle, but it really isn't. It's actually 4 embryological muscles that just merge together over time. This is the master controller of your upper and lower lip, is what lets you narrow your mouth to speak or whistle. As we age, the constant movement of superficial muscle fibers here can cause vertical lip lines. Treating those specific superficial fibers is exactly how we visibly smooth them right back out. Which brilliantly brings us to the mechanics of the famously popular lip flip. So normally the orbicularis oris contracts inward, but if you selectively relax the muscle right where it inserts into the vermilion border, which is just the very edge of your lip, you can actually make that specific part appear bigger. Because the lower part of the muscle is relaxed, the upper resting tone just naturally takes over and rolls the lip outward. It gives you a super subtle, very natural looking pout. Let's see how this all contributes to the downward pull of the lower face. Starting with the depressor anguli oris on top, this pulls the corners of the mouth down. As we get older, we lose fat and tissue resistance, so this downward pull leaves us with a perpetually downturned, kind of aged expression. But put roughly 2 units into each muscle, and it relaxes, totally reversing that effect for a nice little lift. Below that is the depressor labii inferioris.
This one pulls the lower lip outward. Fun fact, a super strong lateral pull here is exactly what causes the lower teeth to show during a smile, a trait you might recognize in Sherry Blair.
Moving on to Section 4, jawline, chin, and chewing, the deep movers. Time to rotate our view and examine the lateral and deep structural muscles carrying all the heavy loads down below. 4 to 6. That is the exact number of botulinum toxin units typically injected right into the mentalis muscle. This muscle starts on the bone in the middle of the chin, and its fibers actually pull the skin inwards, which can cause this dimpled orange peel texturing effect. By using 4 to 6 units to relax it, you smooth out that texture entirely, and you also help the chin lower down. This is absolutely vital for preserving the chin as the lowest point of the face, keeping that beautiful, highly sought-after heart shape. Running super deep within your cheek, right beneath the fat pad, is the buccinator. Now, we rarely treat this with toxin, but anatomically, it's fascinating. Get this, it's actually the strongest muscle in a baby's body, used entirely for sucking during feeding. And here's an awesome fun fact from the researcher of our source material, David. It's famously known as the bugle muscle because of how intensely it's used by brass instrument players. Gliding laterally over to the jaw, we hit the masseter. This is literally the strongest muscle in your entire face during a biting contraction. You can easily feel it bulge out if you bite down hard right now. The crucial takeaway here is that targeting the masseter with injections isn't just a cosmetic trick to shrink an overdeveloped jaw for that heart-shaped book. It is literally a life-changing remedy for bruxism, which is when you unintentionally clench and grind your teeth at night, causing massive headaches. And that brings us to Section 5, the nose and neck, the final connectors. For our final stop in this explainer, we're heading back to the center of the nose and then sweeping all the way down the neck. Right on the bridge of the nose, we have the nasalis muscle. This guy is responsible for those little crinkling lines you get when you scrunch your nose, often affectionately called bunny lines. It's an incredibly safe area to treat by applying just 2 to 4 units per side up near the bone origin. Rather than chasing the muscle down into the face, you can beautifully and safely erase those lines. 80. That is up to how many units are sometimes required to treat our final massive structure, the platysma. Because it's such a vast, wide sheet of muscle, treating it really requires a strategic, high-dose approach. So, why is treating the platysma so impactful? Well, this fascinating muscle runs all the way from your chest, up your neck, and it actually meshes directly into the SMES, the superficial musculoepineurotic system in your face. Because of this huge upward connection, relaxing the platysma does way more than just soften those visible vertical neck bands. It allows for a much sharper jawline, and unexpectedly, it can even provide a subtle lifting effect to the mid-phase by getting rid of that constant downward pull. It is truly the ultimate structural anchor. We've traversed the entire cinematic landscape of the face today, from the brow-raising frontalis all the way down to the anchoring platysma. You've literally seen the levers and pulleys that construct our expressions. So I'll leave you with this. The next time you look in the mirror, ask yourself how this spatial roadmap of form and function changes the way you see human expression. Are you just seeing a smile? Or are you visualizing the magnificent ultra-engineering underneath? Keep visualizing, keep learning, and I'll catch you in the next explainer.